So, Donna, we heard about HPS-THRIVE this morning, a fairly large, very extensive and well done study on HDL lowering. What were your impressions of that study?
Well, this is a study of long extended-release niacin in addition to a drug that inhibits the prostaglandin 2 antagonist so that you don't get the flushing. That drug added on to really extensive lipid-lowering therapy with simvastatin or simvastatin plus ezetimibe. Really had no benefit whatsoever in terms of overall cardiovascular mortality or their primary endpoint of events. It really shows that when you aggressively lower LDL cholesterol, and the mean in that population was 63 milligrams, that you really got no added benefit from raising HDL even as much as they did.
So I guess the hypothesis that HDL raising is, I guess, maybe not dead, but at least not with niacin and not with patients who already have a very low LDL.
Apparently, when you really have low LDL levels, HDL doesn't need to be raised. Someone expressed it like this: when you don't have any garbage, you may not need the garbage truck.
And what about side effects? I was struck by some of the side effects in this trial.
I was really impressed with the level of adverse events. There were 30 serious adverse events per 1,000 patients treated. Now, some of them we would expect. The increase in diabetes and diabetes onset was notable and statistically significant. But in addition, there were more infections, and of real concern in the cardiovascular domain, there was an increase in hemorrhagic stroke that nearly reached statistical significance.
So I guess we have to wait a bit more for maybe another class of drugs that raise HDL to see if it has an effect in reducing events.
Or we may just have to ask that question in a population with modestly elevated LDLs. And populations with well-controlled LDL, I think this study, in addition to AIM-HI, really definitively says niacin doesn't work in that setting.
Terrific.